Every county in Kentucky is facing the devastating effects of the opioid overdose crisis. It's an especially urgent matter for those in the criminal legal system, where a high percentage of people moving through county jails have an opioid use disorder and face a high risk of overdose upon release. Using available opioid settlement funds, counties have a historic chance to change that. But many local leaders still have questions like, what can the funds be used for? Which models have worked in other counties? Do medications work, or is it simply trading one drug for another? How to comply with federal law without the staff and resources to deliver treatment consistently. The good news is, help is available and easy to access. Starting with guidance found in the terms of the National Opioid Settlements, Exhibit E, medications for opioid use disorder are identified as an appropriate and allowable use for abatement funds, and a treatment which is proving to be a highly effective and sustainable response to the overdose crisis across the state. There are 3 FDA-approved medications that treat opioid use disorder: methadone, buprenorphine, and naltrexone. Methadone and buprenorphine are the proven gold standard, effectively managing withdrawal and pain, as well as reducing cravings, relapse, and overdose risk. The results? Facilities using them report reduced recidivism and decreased use of force and restraints. And people who receive MOUD treatment in jail are more than 50% less likely to die from an opioid overdose after returning to their communities. And they are more likely to stay in treatment, avoid risk, and see improved health outcomes overall. Because opioid use disorder is recognized as a disability under the Americans with Disabilities Act, incarcerated individuals are guaranteed access to treatments related to their condition, just as people with diabetes or hypertension are entitled to the medications needed to manage their long-term health. Although opioid use disorder is defined as a chronic, treatable brain disease, more than 80% of incarcerated individuals with this condition are denied care while in custody. This denial not only violates medical standards, it exposes correctional agencies to legal liability under the ADA. That's why it's important for local agencies to be aware that providing access to medications for opioid use disorder isn't optional. It is an ethical and legal obligation. To help implement these evidence-based programs and answer your critical questions, expert technical assistance is available at no cost from major universities and county leadership associations, all working together to support local governments and jails in identifying partners, navigating contracts and federal guidelines, and leveraging existing state and federal resources. With ongoing training sessions near you and a library of toolkits available online, it's easier than ever to get the guidance you need. With the availability of both funding and no-cost technical assistance designated for county officials, this is the moment to act on expanding medications for opioid use disorder in county jails, to save lives and improve the safety and well-being of all those within your care, from patients to service providers to jail staff and all those who've sworn to serve and protect. Find out more and sign up for the free training today.